Back with more of our program for today. Of course, our program each Thursday brought to us by Kaiser Permanente with that fine facility just a short drive up the street in nearby Irvine. Joining us today as our special medical guest, Dr. Richard Szabo. He's the Chief of Urology for Kaiser here in Orange County. Dr. Szabo, welcome to Channel 6.
Thank you.
Good to have you with us today. A little bit about your background, where you studied, and how you ended up here in Southern California.
I did medical school at Stanford. And I went to the New England Deaconess for a year in Boston, and then I did my residency in urology at Stanford. And I was in San Francisco for about 17 years, but my wife's family's down here, so we came down here and transferred from the Kaiser up there to Kaiser down here.
Good. That sounds like you're happy working with Kaiser. That's a good recommendation, and you'll stay with a company and make a move like that. Subject today is one that's, shall we say, a sensitive topic, especially for the gentlemen in our audience. It's erectile dysfunction, commonly referred to as ED. Maybe you can give us a not quite so medical definition of that the average layperson will understand.
Sure. Well, erectile dysfunction is commonly defined as not being able to have an erection satisfactory for intercourse. And that's simply it. It also includes early loss of erection that prevents a man from having satisfaction.
Numbers, what kind of percentages, how many people are normally, gentlemen in our country would be impacted by this problem?
But there's a large study done about 2003 with over 20,000 men, and it was found that the erectile dysfunction, as one would expect, increases with age. People who are in their 40s, only about 4% have erectile dysfunction, and then it steadily increases. And then when you're over 70, it's about 60% of men have erectile dysfunction. But what's very interesting is that across all age groups, if a man is very active, say running 3 hours a week or playing singles tennis 5 days a week, they reduce their rate of erectile dysfunction by about 30%.
So being active has lots of health benefits, and that's just one of them.
That's a very good incentive to be active.
Indeed it is. Other health factors, you mentioned age, you mentioned exercise. Are there other health factors that can have an impact on this?
Certainly high blood pressure, diabetes, obesity, high cholesterol, all those and other health factors too can enter into it. Depression, the need for taking antidepressant drugs. There are certain medications that'll also help it there's other medications that can bring on erectile dysfunction, but the problem with those, the idea that maybe you can stop those medications is you really can't. You can't stop anti-blood pressure medications.
Right.
You have to stay on it, so we have to treat over and above those medications.
We're going to talk about some of the chemical or so-called popular treatments, but first of all, are there other treatments available besides medication?
So in the last decade, medication has famously really helped a lot of men overcome their problems with erectile dysfunction, and paradoxically has even caused a lot of divorces because a lot of people were in their older years, some were comfortable not having sexual intercourse, but interestingly enough, it caused some conflict when all of a sudden the man could indeed have intercourse again, and so that's kind of an interesting side effect of this whole development. But oral medications are the first and foremost treatment. They work in about 50% of people. Usually, if you're having a little bit of an erection, and not a full erection, those oral medications are going to work.
Yeah.
But if they don't work, then the next step usually is either a vacuum erection device, or penile injections, which are done with a very small needle. A lot of people get turned off to it, but it really works very well because it gives a natural feeling erection, although the insertion of the needle isn't so natural. And then there's a little pellet that can be put down the tip of the penis, and that's kind of the same medication that's injected. And then for patients who don't respond to any of those treatments, there are things like penile prostheses, either semi-rigid ones or ones that actually can be pumped up at will and then deflated at will.
Right. Well, I think the thing we hear so much about, and mainly because they advertise a lot for it, probably because they make a lot of money selling it, are the ones that we see advertised so much on television. I guess Viagra was the one that's got the biggest name recognition. We've got Levitra, Cialis, and they all have clever commercials, whether it's the guy getting rid of his compact car and riding home on his new Harley Davidson, or the guys at the Roadhouse playing Viva Viagra instead of Viva Las Vegas, or the couple in the bathtub. There's a bunch of different versions of that, and then there's the time aspect of it. When can we have relations? Well, when the time is right, when we both feel like it, and there's sort of timed release type of things. I'm assuming that a lot of your patients probably just come in and say, "Doctor, can you prescribe, L, V, or C for me?" Normally, you would say what if they did that?
Well, interestingly, in our system, usually the family practitioners or the internists prescribe it first because they don't need to see a urologist for those prescriptions. But if I was the person who was asked, we need to make sure that they're not taking nitrate medications like nitroglycerin or isosorbide medications that help dilate the blood vessels in the heart, because the combination of those types of medications and these phosphodiesterase inhibitors, these different drugs we're talking about, can cause a serious drop in blood pressure, and there have been some deaths. There are also some other very minor complications people have heard about. Actually, they're major, but minor in occurrence that have to do with blindness. But there's only a handful of patients and tens of millions of patients who take the medication. So you're actually much more at risk just driving in your car.
One of the warnings that they do give on some of those television commercials is if you have an erection lasting longer than, I think they say, 4 hours. Is that a possible side effect?
As you see in these commercials, they're advertising to younger and younger men. In fact, these medications are in a way used often as recreational drugs because they give better erections for people who have normal erections. The problem is if you're very young and the erection lasts more than 4 hours, it can last for a day in certain people who really don't need the medication. That can hurt the tissues inside the penis and make it difficult to have normal erections later on. So those people need to go to the emergency room, have an antidote injected, even have blood drained out of the penis.
So just like overdoing a muscle, you can cause damage.
You can cause permanent damage because you choke off the blood supply inside.
It sounds like someone needs to be, I know we see these things advertised every once in a while on the internet. You'll get a hit from somebody offering to sell you supposedly one of these products through the internet. I would imagine that would be something you would be somewhat against.
Well, I remember a study showing that about 30 to 40% of those drugs are bonus, and you don't know what you're getting. And I would feel worried.
Is there a psychological factor involved in erectile dysfunction?
Certainly there is, but unlike what used to be taught years ago, most erectile dysfunction is physiological, it's organic, it's not just in your head, but certainly there are some psychological factors that enter into it.
Right, so as a urologist, you've got to examine all those possibilities, not just the fact that they're on high blood pressure medication or overweight or whatever the other
And
factors.
it's pretty simple to do because...
Yeah. One of the things you also deal with is obviously the hormone issues related to all of this. One of the male hormones we hear a lot about is testosterone. We hear sometimes athletes are maybe adding a little extra to give them a little extra performance out there, along with some other things they shouldn't be doing. Is that something you deal with, replacement therapy there?
Now we can give testosterone not just in shots, but with gels. It's a little bit controversial because of the possibility of activating some prostate cancer that may be going on, although very likely it's safe to do in people who give in people who don't have prostate cancer. But it's shown to be effective in helping people with erectile difficulties only, number one, if their male hormone level in their blood is low to begin with, and number two, usually has to be given along with one of these medications like Viagra or Levitra.
Right. But sometimes you would give that as an adjunct to one of the pills type of things.
If they have low testosterone levels to start.
Which you test for obviously as well. A lot of important issues, a lot of important things, gentlemen. If you have concerns in these areas, obviously I want to talk to your family doctor and perhaps get referral to a urologist like Dr. Szabo. Thank you, sir, for being with us today and talking about what is obviously a sensitive topic, and we appreciate your candor in dealing with it. Thank you.
My pleasure.
Good to have you in the program today. Dr. Richard Szabo, and he's the head of urology with Kaiser Permanente right here in Orange County. And again, if you'd like to find out more about Kaiser and the programs they have to offer, you can give them a call at 932-2052 right here in Orange County. Our program for today continues.